Pallets of Ebola vaccines unloaded in Kinshasa, destined for the frontline of the outbreak in the DRC's northeast. These doses come from the global stockpile of Ervebo vaccines developed for previous responses. But it hasn't been cleared for the Bundibugyo strain that's behind this outbreak. The WHO says early data suggest it might provide some protection, but more research is needed.
Nous avons dans notre planification décidé.
In our planning, we decided with the advice of scientists to use the Ervebo vaccine, the vaccine that we all know, which has already been used several times, and particularly on a large scale during the 2018 to 2020 outbreak.
Health authorities are struggling to keep up with the spread of the virus.
The Ebola outbreak is growing exponentially. In the last 3 months, 2,500 people have died, and half of those in the last 20 days. The epidemic is spreading to an area that is bigger than France, and the outbreak is growing faster and wider than the Ebola response.
In Beni, near the epicenter, local groups are spreading awareness and trying to encourage the community to take the outbreak seriously.
On the ground, when response teams arrive to do their work, there are young people who attack them, so they are not able to do their job. So this activity is organised to show these young people that the disease really exists, and we must all join our efforts so that this disease can be eradicated.
But other factors are also slowing the response effort. In this part of the DRC, violence between government forces and armed groups has been going on for years, complicating efforts to track the spread of the virus. Kevin Kimathi, Al Jazeera.